Hi everyone, I'm Tommy, your new virtual colleague and professor created by Dr. Nelson Jimenez. I will help the doctor to teach the classes and I will be with you throughout the course. Today's class topic is bacteria, the most primitive living beings on our planet. Did you know that mitochondria used to be independent? Well, they were. 2 billion years ago, before mitochondria were an organelle of the cell, they were free-swimming bacteria in the ocean. It was an anaerobic, that is, capable of living in the presence of toxic oxygen and even using it for energy. At one point, that bacterium was engulfed by another cell, a nucleated and anaerobic cell. However, instead of being digested by each other, the bacterium and the cell established a symbiotic relationship. The bacterium contributed its ability to breathe oxygen, and in return, the eukaryotic cell fed it. Let's begin our tour of the world of bacteria. Gram staining is the common, important, and most used differential staining technique in microbiology. This test differentiates the bacteria into gram-positive and gram-negative bacteria, which helps in the classification and differentiation of microorganisms, both in research and clinical laboratories. Bacteria are prokaryotic microorganisms that are a few micrometers in size, usually between 0.5 and 5 micrometers in length and various shapes. Bacteria are prokaryotic cells. Therefore, unlike eukaryotic cells, they do not have a defined nucleus, nor do they generally have internal membranous organelles. They generally have a cytoplasmic membrane, cell wall, and capsule. Many bacteria have flagella or other locomotion systems to move. Bacteriology, a branch of microbiology, deals with the study of bacteria. Although the term bacteria traditionally included all prokaryotes, taxonomy and scientific nomenclature currently divide them into two groups. These evolutionary domains are called bacteria and archaea. In the human body, there are approximately 10 times as many bacterial cells as human cells, with a large number of bacteria on the skin and in the digestive tract. Although the protective effect of the immune system renders the vast majority of these bacteria harmless or beneficial, some pathogenic bacteria can cause infectious diseases including cholera, diphtheria, scarlet fever, leprosy, syphilis, typhus, etc. The most common fatal bacterial diseases are respiratory infections, with a mortality for tuberculosis alone of about 1.5 million people in 2018. Antibiotics are used worldwide to treat bacterial infections. Antibiotics are effective against bacteria, as they inhibit the formation of the cell wall or stop other processes in their life cycle. They are also widely used in agriculture and livestock in the absence of disease, causing bacterial resistance to antibiotics to become widespread. In industry, bacteria are important in processes such as wastewater treatment, in the production of butter, cheese, vinegar, yogurt, etc., and in the manufacture of medicines and other chemical products. According to their shape, bacteria are classified as cocci if they are in the form of spheres, bacilli if they are rod-shaped, spirilla if its shape is spiral, and vibrios in case their silhouette resembles a comma. Spirals and vibrios do not clump together, but cocci and bacilli, yes. Depending on how they do it, they are classified as strep if they are in a chain, staphyls if group is a cluster, sarsinas, cube-shaped grouping, diplos if they are 2 by 2, or tetras in groups of 4. Thus, combining grouping and shape in one word, we will find staphylococci, diplococci, streptococci, streptobacilli, etc. Bacterial nutrition is highly varying because of the ability of bacteria to synthesize food by photosynthesis and also survive on other living to dead organic matter. So they can make the food and also eat the food that is made. Bacteria obtain energy from various resources. Many bacteria are capable of making their food and are called autotrophs. Others who depend on other living organisms or organic matter for nutrient needs are called heterotrophs. Organisms that require a constant supply of oxygen in order to live are called obligate aerobes, like Mycobacterium tuberculosis. Organisms that must live in the absence of oxygen are called obligate anaerobes. Oxygen would kill them. Examplo, Clostridium botulinum. Organisms that can survive with or without oxygen are called facultative anaerobes. Examplo, E. coli. Anaerobes perform fermentation to release energy, and aerobes perform cellular respiration to release energy. Growth in bacteria is directly related to availability of food and production of waste products. Reproduction can occur by binary fission, asexual reproduction, in which an organism replicates its DNA and divides in half, producing 2 identical daughter cells. In bacteria, the increase in cell size, growth, and reproduction by cell division are closely linked, as in most single-celled organisms. It occurs by duplication, and cells with identical hereditary information are obtained. Bacteria grow to a fixed size and then reproduce by binary fission, a form of asexual reproduction. Under the right conditions, a gram-positive bacterium can divide every 20 to 30 minutes and a gram-negative bacterium every 15 to 20 minutes, and in about 16 hours their number can rise to about 5 billion. In poor environmental conditions, bacteria form spores that remain dormant for months, years, etc., until conditions become favorable again. Endospore is a type of spore formed when a bacterium produces a thick internal wall that encloses its DNA and a portion of its cytoplasm. Certain bacteria make spores as a way to defend themselves. Spores have thick walls. They can resist high temperatures, humidity, and other environmental conditions. The bacteria Clostridia form spores. These spores create the bacteria that cause a rare condition called gas gangrene and a type of colitis that is linked to use of antibiotics. Bacterial requirements for growth include sources of energy, organic carbon, example sugars and fatty acids, and metal ions, example iron. Optimal temperature, pH, and the need or lack of need for oxygen are important. Bacteria can be classified into the following types according to the basis of their ability to synthesize essential metabolism. Autotrophs. These are bacteria which are able to synthesize their own organic food from inorganic substances. They use carbon dioxide for obtaining carbon and utilize hydrogen sulfide or ammonia or hydrogen as the source of hydrogen to reduce carbon. Heterotrophs. Microbes obtain their carbon from organic compounds such as sugar, protein, and lipids. Hydrogen is usually obtained from water, and oxygen is obtained from atmosphere or from water where it is found in dissolved state. Here are some bacteria and the diseases they cause. I recommend that you investigate a little more about the characteristics of each one. Take note. A gram-negative spiral bacteria, Campylobacter jejuni. Campylobacter infections typically cause diarrhea but occasionally cause bacteremia and result in endocarditis, osteomyelitis, or septic arthritis. A gram-negative spirochetes, Treponema pallidum, is the causative agent of syphilis. This bacterium can only be seen with the dark field technique. Common manifestations include genital ulcers, skin lesions, meningitis, aortic disease, and neurologic syndromes. This gram-negative spirochete is called Borrelia burgdorferi. Lyme disease is a tick-transmitted infection. Early symptoms include an erythema migrans rash, which may be followed weeks to months later by neurologic, cardiac, or joint abnormalities. Legionella pneumophila is a gram-negative bacillus that most often causes pneumonia with extrapulmonary features. Pertussis is a highly communicable disease occurring mostly in children and adolescents and caused by the gram-negative bacterium Bordetella pertussis. Symptoms are initially those of nonspecific upper respiratory infection followed by paroxysmal or spasmodic coughing that usually ends in a prolonged, high-pitched, crowing inspiration. Pseudomonas aeruginosa and other members of this group of gram-negative bacilli are opportunistic pathogens that frequently cause hospital-acquired infections, particularly in ventilator patients, burn patients, and patients with neutropenia or chronic debility. Many sites can be infected, and infection is usually severe. Diagnosis is by culture. Antibiotic choice varies with the pathogen and must be guided by susceptibility testing because resistance is common. Cholera is an acute infection of the small bowel by the gram-negative bacterium Vibrio cholerae, which secretes a toxin that causes copious watery diarrhea, leading to dehydration, oliguria, and circulatory collapse. Infection is typically through contaminated water or shellfish. Typhoid fever is a systemic disease caused by the gram-negative bacterium Salmonella enterica serotype typhi. Symptoms are high fever, prostration, abdominal pain, and a rose-colored rash. Diagnosis is clinical and confirmed by culture. Treatment is with ceftriaxone, ciprofloxacin, or azithromycin. Several different subtypes of Escherichia coli cause diarrhea. The epidemiology and clinical manifestations vary greatly depending on the subtype. Symptoms of hemorrhagic E. coli are severe abdominal cramps which begin suddenly along with watery diarrhea, which may become bloody within 24 hours. The diarrhea usually lasts 1 to 8 days. Fever is usually absent or mild, but occasionally can exceed 102 degF. Fusobacterium is a gram-negative anaerobic rods. Live in between teeth and gums, cause tooth abscesses and periodontal disease. Teeth have nothing to anchor, bone is destroyed. Gonorrhea is caused by the bacterium Neisseria gonorrhoeae. It typically infects epithelia of the urethra, cervix, rectum, pharynx, or conjunctiva, causing irritation or pain and purulent discharge. Dissemination to skin and joints, which is uncommon, causes sores on the skin, fever, and migratory polyarthritis or post-articular septic arthritis. Meningococci, Neisseria meningitidis, are gram-negative diplococci that cause meningitis and meningococcemia. Symptoms, usually severe, include headache, nausea, vomiting, photophobia, lethargy, rash, multiple organ failure, shock, and disseminated intravascular coagulation. Acinetobacter species are gram-negative organisms that can cause suppurative infections in any organ system. These bacteria are often opportunists in hospitalized patients. Acinetobacter are gram-negative aerobic bacilli or coccobacilli that belong to the family Moraxellaceae. They are ubiquitous and can survive on dry surfaces for up to a month and are commonly carried on the skin of healthcare workers, increasing the likelihood of patients being colonized and medical equipment being contaminated. There are many species of Acinetobacter. All can cause human disease, but Acinetobacter baumannii accounts for about 80% of infections. 3 species of chlamydia cause human disease, including sexually transmitted infections and respiratory infections. All are susceptible to macrolides, for example, azithromycin, tetracyclines, for example, doxycycline, and fluoroquinolones. Chlamydia are non-motile, obligate intracellular bacteria. They contain DNA, RNA, and ribosomes and make their own proteins and nucleic acids. However, they depend on the host's cell for 3 of their 4 nucleoside triphosphates and use host adenosine triphosphate, AT, to synthesize chlamydial protein. Rocky Mountain spotted fever, RMSF, is caused by Rickettsia rickettsiae and transmitted by ixoid ticks. Symptoms are high fever, severe headache, and rash. RMSF is limited to the Western Hemisphere. Initially recognized in the Rocky Mountain states, it occurs in practically all of the U.S. and throughout Central and South America. In humans, infection occurs mainly from March to September when adult ticks are active and people are most likely to be in tick-infested areas. In southern states, sporadic cases occur throughout the year. Mycoplasmas are ubiquitous bacteria that differ from other prokaryotes in that they lack a cell wall. Mycoplasma pneumoniae is a common cause of pneumonia, particularly community-acquired pneumonia. Increasing evidence suggests that Mycoplasma genitalium and Uriplasma urolithicum cause some cases of non-gonococcal urethritis. They, and Mycoplasma hymenes, are often present in patients with other urogenital infections, for example, vaginitis, cervicitis, pyelonephritis, pelvic inflammatory disease, and some non-urogenital infections, but their role in these infections is not clear. Mycoplasmas are not visible with light microscopy. Culture is technically difficult and often unavailable, but laboratory diagnosis is possible with nucleic acid amplification tests or by detection of antibodies. Frequently, diagnosis must be by exclusion. Methicillin-resistant Staphylococcus aureus, or MRSA, is a strain of Staphylococcus aureus bacteria that has become resistant to several antibiotics, first penicillin in 1947 and then methicillin. There is a new strain that has developed resistance to vancomycin, one of the few antibiotics that were capable of controlling this bacterium. It was originally discovered in the United Kingdom in 1961 and is now widespread. Although MRSA colonization in an otherwise healthy individual is generally not serious, infection with this microbe can be life-threatening in patients with deep wounds, intravenous catheters, or other instruments that introduce foreign bodies, or as a secondary infection in patients with a weakened immune system. MRSA primarily causes nosocomial infection, that is, an infection acquired in a hospital. Its most serious manifestation is nosocomial pneumonia, a disease that can be fatal and is contracted through the insertion of a ventilator tube into the patient's body. Streptococci are gram-positive aerobic organisms that cause many disorders including pharyngitis, pneumonia, wound and skin infections, sepsis, and endocarditis. Symptoms vary with the organ infected. Sequelae of infections due to group A beta hemolytic streptococci may include rheumatic fever and glomerulonephritis. Most strains are sensitive to penicillin, but macrolide-resistant strains have recently emerged. Tetanus is acute poisoning from a neurotoxin produced by Clostridium tetani. Symptoms are intermittent tonic spasms of voluntary muscles. Spasm of the masseters accounts for the name Laksha. Diagnosis is clinical. Treatment is with human tetanus immune globulin and intensive support. Tetanus bacilli form durable spores that occur in soil and animal feces and remain viable for years. Patients with burns, surgical wounds, or a history of injection drug abuse are especially prone to developing tetanus. However, tetanus may follow trivial or even inapparent wounds. Infection may also develop postpartum in the uterus, maternal tetanus, and in a neonate's umbilicus, tetanus neonatorum, as a result of unsanitary delivery and umbilical cord care practices. Diabetes and a history of immunosuppression may be risk factors for tetanus. Clostridial soft tissue infections usually develop hours or days after an extremity is injured by severe crushing or penetrating trauma that devitalizes tissue, creating anaerobic conditions. The presence of foreign material, even if sterile, markedly increases risk of clostridial infection. Infection may also occur in operative wounds, particularly in patients with underlying occlusive vascular disease. Clostridial soft tissue infections include cellulitis, myositis, and clostridial myonecrosis. They usually occur after trauma. Symptoms may include edema, pain, gasp of crepitation, foul-smelling exudates, intense coloration of the site, and progression to shock, renal failure, and sometimes death. Diagnosis is by inspection, smell, and gram stain, and is confirmed by culture. Treatment is with penicillin and surgical debridement. Hyperbaric oxygen is sometimes beneficial. Toxins produced by Clostridioides difficile strains in the gastrointestinal tract cause pseudomembranous colitis, typically after antibiotic use. Symptoms are diarrhea, sometimes bloody, rarely progressing to toxic metacolon, colonic perforation, sepsis, and acute abdomen. Diagnosis is by identifying C. difficile toxin in stool. Anthrax is caused by the gram-positive Bacillus anthracis, which are toxin-producing, encapsulated, facultative anaerobic organisms. Anthrax, an often fatal disease of animals, is transmitted to humans by contact with infected animals or their products. In humans, infection is typically acquired through the skin. Inhalation infection is less common. Oropharyngeal, meningeal, and gastrointestinal infections are rare. For inhalation and gastrointestinal infections, nonspecific local symptoms are typically followed in several days by severe systemic illness, shock, and often death. Empiric treatment is with ciprofloxacin, levofloxacin, moxifloxacin, or doxycycline. A vaccine is available. Food poisoning caused by Bacillus cereus is an acute intoxication that occurs when this microorganism produces toxins, causing two types of gastrointestinal illness: an emetic vomiting syndrome or a diarrheal syndrome. Bacillus cereus is considered a relatively common cause of gastroenteritis worldwide. Bacillus cereus is widespread in the environment and commonly found in the soil. It is able to produce spores that are resistant to heat and desiccation, therefore it is not uncommon to isolate it from both raw and cooked foods. These spores will germinate into the vegetative form of Bacillus cereus and grow if the food is held under favorable conditions. Diphtheria is an acute pharyngeal or cutaneous infection caused mainly by toxigenic strains of the gram-positive bacillus, Corynebacterium diphtheriae, and rarely by other, less common Corynebacterium species. Symptoms are either nonspecific skin infections or pseudomembranous pharyngitis followed by myocardial and neural tissue damage secondary to the exotoxin. An asymptomatic carrier state also exists. Diagnosis is clinical and confirmed by culture. Treatment is with antitoxin and penicillin or erythromycin. Childhood vaccination and booster doses should be routine. Tuberculosis is a chronic progressive mycobacterial infection, often with an asymptomatic latent period following initial infection. Tuberculosis most commonly affects the lungs. Symptoms include productive cough, fever, weight loss, and malaise. Diagnosis is most often by sputum smear and culture and, when available, by nucleic acid amplification tests. Treatment is with multiple antimicrobial drugs given for at least 4 months. Mycobacterium avium complex consists of multiple non-tuberculosis mycobacterial species and TM, which cannot be distinguished in the microbiology laboratory and requires genetic testing. A newcomer to the Mycobacterium avium complex is the Mycobacterium parentracellular, identified in pulmonary infections in Southeast Asia in 2016. Mycobacterium avium complex is the most common cause of non-tuberculosis mycobacterial species infections in humans, and respiratory system is the most common site of infection. Leprosy is a chronic infection usually caused by the acid-fast bacilli Mycobacterium leprae or the closely related organism Mycobacterium lepromatosis. These organisms have a unique tropism for peripheral nerves, skin, and mucous membranes of the upper respiratory tract. Symptoms are myriad and include anesthetic polymorphic skin lesions and peripheral neuropathy. Diagnosis is clinical and confirmed by biopsy. Treatment is typically with dapsone plus other antimycobacterial drugs. Patients rapidly become non-contagious after starting therapy. Antibiotics are chemicals which either kill bacteria or prevent their growth and reproduction. Bacteria and other microbes produce antibiotics to reduce competition from other organisms. Penicillin was the first to be used to fight disease, discovered accidentally by Alexander Fleming in 1928. Two scientists, Walter Florey and Ernst Chain, determined how to use penicillin to treat disease in 1939. The discovery of antibiotics revolutionized the treatment of disease. Antibiotics attack bacteria in 5 ways. 1. Some damage the cell walls or prevent new cell wall from forming. 2. Some damage the cell membrane. 3. Some prevent protein synthesis. 4. Some prevent DNA from being copied. 5. Some interfere with bacterial metabolism. Some bacteria have developed a resistance to the effect of some antibiotics. The number of resistant bacteria is growing. The problem is increased by overuse and misuse of antibiotics. Use of antibiotics to treat viral infections. Antibiotics don't affect viruses. The use of antibiotics in livestock, cattle, chickens, pigs. Antibiotics show up in the meat and milk. People take the antibiotics until they feel better, but stop before all of the bacteria are destroyed. This kills the most susceptible bacteria, but leaves the more resistant bacteria. Summarizing. In this class, we study bacteria, the most primitive prokaryotic organisms on Earth. Most of them are not pathogenic, many even help us in daily life, and are part of our normal flora and our hollow organs such as the intestine. However, a group of bacteria cause disease. Antibiotics have been developed to combat them. Some bacteria have developed resistance to antibiotics, making treatment more difficult. Bacteria are classified based on their shape, grouping, and staining. Bacteria reproduce rapidly by binary fission. Some of them have autotrophic nutrition and others heterotrophic. When a bacterium forms a spore, it will be inactive for a long time with metabolism almost stopped until the necessary conditions for its development and growth are present. We hope this video has helped you better understand pathogenic bacteria and the risks they pose. It is always important to stay informed about these microorganisms in order to take the appropriate preventive measures. Thanks for watching this video, and remember, prevention is the best way to protect yourself.